We have an incredible guest who has been remarkably busy for quite some time. Tom, could you please introduce our guest for tonight?
All right, let me take some breaths. He is the chief of the clinical and research programs in pediatrics, psychopharmacology, and adult ADHD at the Massachusetts General Hospital, director of the Alan and Lorraine Bressler Clinical and Research Program for Autism Spectrum Disorders at the Massachusetts General Hospital, and professor of psychiatry at the Harvard Medical School. Oh, and he's the author and co-author of over 800 scientific articles, 650 scientific abstracts, and 70 book chapters. And during the opening ceremony of the 8th World Congress on ADHD 2021, he was awarded the Medal of the World Federation of ADHD for a lifetime of outstanding contributions to the science and practice of ADHD. Ladies, gentlemen, pets, furniture, Dr. Joe, Sif,
Yeah.
Biederman.
Yeah! Wow. Yes, absolutely. As much applause as we can have.
Standing ovations.
Standing ovations. Absolutely. Dr. Biederman, welcome to the Dr. Joe Show. I am so honored to have you here.
My pleasure to be here.
It is great. And I just wanted to have full disclosure. Dr. Biederman was one of my absolute influential professors and mentors when I was doing my child psychiatry fellowship way back when, 93 to 95 at MGH McLean. So he's absolutely laid the foundation for everything that I've done since. So thank you for that right off the top.
My pleasure. You have done very well, and it was a pleasure to supervise you. I think it was not always it is, as you know. We have very good residents, but you are excellent.
Oh, right. Oh, thank you.
Isn't it nice, Dr. Biederman, to see your tutelage come so far and be so successful?
One of my biggest pleasures is to see the unfolding careers of people that work and started. It's really a starting point in their careers, residency, and then they unfold and do great things. So Joe is one of those.
Thank you.
Very rewarding.
And I just want to give a shout out to Andreas Martin, who was in my class. He was also one of those people that Dr. Biederman trained, and he's doing great, even though he's at that other school.
Yeah.
Yale. I mean, we sometimes, we don't always talk about Yale, and we're talking about Harvard, but it's okay. We'll bring it up now. So Dr. Biederman, please tell us a little bit about yourself. I want people to understand that the world of attention deficit was really not existing when you started your career.
Well, I would like to go to the preceding step. When I started child psychiatry, when I trained in child psychiatry at Children's Hospital in Boston, I did not medicate a single child.
Huh.
After coming to the general, I decided to develop a totally new idea that is pediatric psychopharmacology. Did not exist before. The idea that children may have problems that are not psychological, that not everything is a reaction to bad mother. So it was quite revolutionary. So the establishment of pediatric psychopharmacology, kind of diagnosis, differential diagnosis, created a stage when I was seeing children. The most common condition that affect children is ADHD. The most common reason for referral. Parents started telling me that, doctor, I had the same problem. I always thought that I was stupid, incompetent, all kind of epithets that they remember. This is a scarring condition, not having the opportunity to be treated in time, or when you, in your formative years, does not produce great memories. So, piqued my curiosity. There are several things that happen simultaneously. One is ADHD was thought to be a kind of an idiotic, irrelevant condition that affects some boys. Okay, so I started looking at whether is it true? Does it affect girls, for example? I did the largest study ever documenting that ADHD affects girls in a very similar manner as affects boys. Quite revolutionary idea. At that point in time, no girls were diagnosed. Okay, and that was impossible. So the concerted effort to establish that ADHD is a persistent illness that continues into adult life, totally unknown. Okay, and that piqued the curiosity of saying, well, if these adults, parents of ADHD children, tell me that they have the same problem, and I also know that the children will continue to be affected into adult life, must be a sizable number of adults out there with this disorder. So that's the starting point of publishing family study. One of the first things that I did, ADHD is a genetic illness. So I reasoned that if adult ADHD is a real disorder, the children of adult ADHD people will have ADHD. And in fact, we published this paper in American Journal of Psychiatry many years ago, documenting that 50% of adults with ADHD that have children have an affected child. It's twice as large. If you start with a child, you have 25% risk in pregnancy, but if you start with an adult, you have a very high risk. It's just that the adult form, the persistent form of the disorder is very genetic. So that's the way that started. And the next thing to do is, does it respond to the same treatment? Quite a revolutionary idea. Can you use the same medications adjusted for size? Of course, you cannot give a baby Tylenol to an adult, so they have to be adjusted. So we started doing clinical trial. We published with Tom Spencer the first clinical trial of stimulants in adults with ADHD, and that led the way to pharmaceutical companies developing drugs specifically for ADHD and getting FDA approval. But remember, a condition that affects 5 to 10% of children worldwide that can benefit from therapeutics that are highly effective and can change people's lives. So it's an extraordinary contribution to the well-being of millions across the world, not just a few people in my practice.
Totally amazing history. There are so many questions to ask about this, and I hope everyone is paying attention. No pun intended. I can't help it, but one of the things that I have the great privilege of is not only having you here, but I also have the privilege of paying attention to our sponsors, because without them, we would have an enormous deficit. So let's do this. Folks, stay tuned with the Dr. Joe Show, but we're going to take our first commercial break. We'll be right back.
Stretch the cat.